I'm going to start with a little information about the CTSC of Northern Ohio. So the CTSC is an acronym that stands for Clinical and Translational Science Collaborative of Northern Ohio. Case Western Reserve University is the recipient of this Clinical and Translational Science Award. This award or grant is from NCATS, the National Center for Advancing Translational Science, part of the National Institutes of Health, or NIH. You can read through the goals of this national program here. There are over 60 CTSAs working across the country. And of these, more than 60, there are 3 in Ohio. So we have one at Case Western Reserve University, one at Ohio State, and one at the University of Cincinnati. We call ourselves here in Northern Ohio a collaborative, hence that's why we have collaborative in our title. But the others in Ohio are Clinical and Translational Science Center and Institute, respectively. But we are all CTS awardees. CWRU has held this award since 2007, and we are currently at the end of year 2 in a 7-year cycle. So we are intentional about our priorities and our mission and aims by engaging our stakeholders, the workforce and patients, community members to collaborate locally, regionally, and nationally. In these first 2 years of this CTSC cycle, we've begun implementing and disseminating CTSC research programs across clinical and community settings to advance access to health interventions in our area and beyond. We want to understand health challenges and overcoming barriers to recruitment in clinical research, then test and scale interventions aimed at breaking down these barriers to diversify study engagement. In the past 2 years, we have funded over 25 pilot projects for early stage researchers focused on these aims. Okay. So importantly, the Case Western Reserve CTSC is not new, so it's been around for over 17 years. Our CTSC has developed a new generation of researchers, enhanced collaborations among investigators, streamlined discovery by building partnerships among industry and community partners, but we haven't done it alone. Our partners since the beginning have been all the large hospital systems in Cleveland, so UH and the clinic, Metro Health and the VA, but as you can see there on the screen. But for the first time ever, we've expanded beyond Greater Cleveland to include 2 new partners, so NeoMed, Northeast Ohio Medical University, and the University of Toledo, which is very exciting because it offers a whole new perspective on who translational science is for and how we can make an impact wider than the footprint it had in the past. In addition to all the research we provide, we also manage a few companion grants, and I'm going to read those as well. So these are the K2 or K-12 Career Development Program for Early Stage Investigators, the T32, which is a pre- and postdoctoral programs, R25, which focuses on undergraduate research, and the RC2, which is a large grant we administer addressing innovation and overcoming barriers in clinical and translational science. And so now I'm going to pass the mic to Dr. Gherkin, and he's going to present about translational science and translational research. Thank you, Dr. Gherkin.
Thank you, Anna. Next slide, please. I just want to start by saying that I have received CTSC support multiple times over the years, and these annual pilot awards and other types of support and the resources available at the CTSC helped me and my lab translate discoveries and inventions from our lab to the outside world through translation and commercialization, translation licensing and commercialization activities. So in the next few slides, I would like to share with you what we mean by translation, translational research, translational science, and what we consider to be competitive and suitable for the funding opportunity that we are presenting to you right now. So I will start with the word translation, which essentially means that translation means converting observations, discoveries, inventions from laboratories, clinics, and communities into practical interventions, such as new treatments, diagnostics, behavioral changes to enhance patients' health, public health. Translation research specifically focuses on advancing specific steps in this process for particular diseases or targets, driving targeted solutions. So translation research is a little bit more specific than translational science, which I will define next. Translational science is disease agnostic and it optimizes the entire process. And you can learn more about this principle and its principles at ncats.nih.gov if you are interested. But overall, translational science is all about improving the process. It is disease agnostic. If you have a particular disease focus, it's probably translational research. But if you are tackling a common problem in the translational pipeline shared by multiple diseases or multiple treatments, multiple technologies, let's say, then it is likely translational science. Next slide, please. In 2020, translation research rapidly propelled COVID-19 solutions, including saliva-based diagnostics, remdesivir trials, and Moderna's vaccine development. In this slide, we are giving you an example on how translation research versus translational science can be exemplified through some processes that took place in the COVID-19 pandemic. Key milestones, such as the FDA vaccine approvals, showcase how research translated into real-world impact during that global crisis. We acknowledge Darcy Friedman from Case Western Reserve University for this slide. This is actually from a publication in AJMC's 2021 timeline of COVID-19 developments. You can actually look and see the timeline of events that took place. And these are the standard typical translational research steps and the processes that happen from all the way from definition of the problem, creating a solution and translating the solution to the public. Next slide, please. Going into a little bit more details, translational science played a critical role in scaling COVID-19 responses by improving vaccine adoption, treatment access, and public health policies. Milestones such as the 100,000 daily US cases and Pfizer's vaccine approval highlight the power of process-focused science, again, based on this article that we are citing here. Translational science processes, focusing on translational science processes helped those achievements possible. These efforts also demonstrate how translation science addresses systemic challenges to deliver equitable health solutions. Next slide, please. This slide also reinforces how translation science enhanced COVID-19 responses by streamlining access, building trust, and informing effective policies. And we can also reflect on this question: how can your research improve health delivery processes for a broader impact? So if you are asking research questions like this, it is more likely that it is a translational science project. We thank again Darcy Friedman for illustrating this translational science example in this case. Next slide, please. So translational research and translational science, in a basic definition, it's all about imagining another way of doing something. Translation means you go from a basic discovery and invention to the use in the general public with the patients in the public health sector. But the idea is imagining another way. Translation research, for example, could accelerate understanding of COVID-19's pathogenesis, and it can expand SARS-CoV-2 testing, which happened, and increase clinical trial participation. But translational science could have helped and has helped with the vaccine adoption, and it also improved healthcare trust, and it also shaped policies to address social risk factors, as also discussed in this publication. And we try to use COVID-19 as an example, but of course you have your own projects, you have your own disease focus areas. And we encourage you to propose a project that tackles similar systemic challenges for for existing and future health problems in the society. So think about, if it is a translation research project, think about how you can transform the way we diagnose or treat or manage a disease, or if it is a translational science, how can we address systemic challenges that are faced by multiple diseases by a broader group of patients or individuals or the public. Next slide. So next, we will focus on a really objective and clear definition of what we mean by the translational process and the different stages of this process. And we want to emphasize that CTSC currently funds T2, T3, and T4 level of research activities in this area. T0 is typically considered basic science, and T1 is very early stage translational research. It's a little bit advanced, a little bit more advanced than basic research, but it might still be too early for some of the funding opportunities here. And there is a slight overlap with T1, as you can see. So there might be some exceptions, but overall, we are interested in seeing more advanced stages of research. So you can actually see that T2 is the translation into patients, and translation T3 is translation to practice, and T4 is translation to populations. If you are, for example, starting an early stage clinical study, that might be a T2 level application. If it is still early, if you have not engaged with any patients or any potential study participants, that might be more on the T1 stage. And this is one of the most common questions that we receive. If you are not sure about the stage of your translation research project or your project, we are here to help, and you can always reach out to us and check and see if your project falls into one of these stages. And as a requirement for application, we expect you to clearly define and justify the level of translation in your letter of intent and in your full proposal. So this has to be crystal clear what stage exactly your translational research project or translation science project is, and what is the justification for that. Next slide, please. This is a summary of what I already described, but let me just re-emphasize. The CTS research program funds T2 level projects, such as clinical studies, clinical trials, and clinical guideline development to advance evidence-based practices. T3 projects might include community-based participatory research and implementation studies, and T4 projects might include projects that are focused on population level outcomes or policy analysis. So those are all T3 and T4 level projects. Overall, we seek proposals that deliver scalable, equitable solutions, particularly for rural and underserved populations, as also noted in the RFA. And overall, the translation research, translation science projects at T2, T4, T2, T3, T4 levels. And you can actually see other examples here. Did I miss anything, Anna?
No, you got it. It's great.
Thank you very much.
Thank you, Umit, so much. Okay, so now we are going to move into more specifics regarding this current RFA, and I will go through those right now. Okay, so all of the details I describe here obviously are in the RFA that's on our website. There's a resource tab somewhere here in this webinar for you guys to access the website that has the RFA on it, There's some other documents there that Umit and I put together before this webinar addressing the questions that you guys had put forward when you signed up for this webinar. So if you should be able to find your answer, but as Umit said, if you haven't been able to hear your answer at the end of this, we are available. So I highly encourage you to review in detail the RFA, but as you're thinking about your application, keep in mind the CTSC's goals for the CTS Research Pilot Program. And so they're listed here, and I won't read them in detail, but the larger scope of this funding is here to support projects promoting overall health and reducing the burden of chronic disease illness through innovative technology. So we'd like to see principal investigators, PIs from multiple institutions. And we'd like to see the development of new collaboration pathways that lead to long-term relationships cross-institutionally. And so they're not limited to academic or clinical partners, but community partners are encouraged as well as collaborators. Some other goals to highlight would be that the research yields high impact results addressing current healthcare challenges. Are the results of the research scalable? We're looking for projects that will bring innovative solutions to larger populations. So here's some more nuts and bolts. All projects will start July 1, 2026. That's next July. And they can be either 2 to 3 year or 3 years in length. Again, is it scalable? Is it generalizable? Is it a strategy that can be operationalized to other translational research projects? What's the technology being utilized? So, we will be able to award up to 3 grants, 125 to 175,000 per year in direct costs. So, and then, some other examples that I can offer you guys are, does this using technology to improve health outcomes, ensuring access to new biomedical science and technology, using tools to promote self-monitoring of chronic illness, some of this that Uma has mentioned already. And so we're just sort of iterating and reiterating for you guys. Tools like AI, AI-powered conversational agents, electronic systems to identify research participants, tech-based tools to assess or monitor risk factors, and outcomes to support the care of patients at home. So additionally, if you're not completely familiar with translational science or translational research, even after Dr. Gergen's great explanations, there are appendices in the RFA to help you with additional information. Again, reach out to us if you're still, if there still are questions. Importantly, as with all CTSC of Northern Ohio funding, you'll need to have at least 2 partner institutions included in your proposal. At this time, NeoMed and University of Toledo can be co-investigators, but not principal investigators due to the nature of the current partnership with the CTSC. And community partners as well can be co-investigators, and they would be sort of considered a third partner. All right, eligibility. So eligibility to apply, the PI, if the PI is not faculty at case, like a physician from a medical center, they must also have a faculty appointment at case. As mentioned before, PIs can be from multiple institutional partners, and we encourage that. You must be eligible to apply for an NIH grant. Those eligibility requirements, if you care to know them, are at the link sort of at the bottom of this slide. It goes to the NIH. And as mentioned before, University of Toledo and NeoMed and community health organizational leaders can be co-investigators. Okay. So here are, we have 8 areas of research that are a priority for this funding mechanism. So keep in mind that reviewers are looking for projects incorporating one or more of these aspects in their application. So again, making sure that you review these in the RFA, and if your project already has some of these areas, that's great. But if not, you see where you might be able to add them. Some of these would not be hard to integrate into a project. We've already mentioned translational science and dissemination implementation. Projects that develop and use innovative techniques in clinical studies with community and clinical partners are another priority. The CTSC has resources and consultations to help researchers with the various aspects of clinical trials, and also with using informatics tools like the Cosmos or the Trinetics. And if you want more information about that, any of those things, you can reach out to us. We have specific resources around Cosmos, and we can answer those questions. Okay, so additional priority areas are any health issues related to the combined significant burden of conditions that unfairly affect certain populations. Implementation, innovation in getting evidence-based research into routine healthcare policy or clinical practice, community or clinical interventions aimed at health promotion, and studies that investigate and improve some aspect of the research process. Okay, so those are our priority areas and our goals and eligibility requirements. Next, we're going to discuss the letter of intent, which is what the call is out for right now. So the LOI is 1 page. It's due June 30th at 11:59 p.m. So at the end of the day, via InfoReady. So that's our grant management system. And then applicants will be selected by August 1 and invited to submit a full proposal. So the ideal letter of intent will describe, as it was saying, a translational research or translational science approach with quantitative and or qualitative outcomes. You'll also want to show in the letter how your project ultimately leads to a change in health outcomes. I'll go through the LOI components next. Again, all of this information is available in the RFA as well. Okay, so LOI is a brief summary of the proposal, 1 page maximum, that must address the following. So all of these bulleted items on the slide, and I can just give some details about each one of these things. So question, hypothesis of the study. This section should be about 1/4 page and describe overall health-related goals addressed by the hypothesis or the premise or the scientific question. The pilot can be within a larger plan, but should stand alone as a milestone to the larger effort. Okay. So the innovation and translation, this section should be about 1/4 page as well. Describe how your project fills a critical translational gap and discuss anticipated results. Feasibility, describe the feasible elements of your study. Include in this section any potential roadblocks or concerns that you might have. Project milestones. This should describe the project plan, again, about 1/4 page. This is the project scope. So we suggest kind of no more than 3 temporal or decision-making milestones that can be achieved within the budget allowed and the time frame allowed. Please include any estimate of how long each milestone will take, why it's critical to the proposal, and any long-term plans for your research. Budget summary, how the awards will be utilized and distributed, human subjects, the IRB approval, and where you are sort of in your IRB process. Very important to note that IRB approval must be obtained by March. If you're invited for a full proposal, IRB approval must be obtained by March 31st of 2026. So that's let's see, yeah, that's about 3.5 months after you would be notified. So intellectual property. Has this project been submitted or received intellectual property protection? If yes, do you plan to file an invention disclosure? If not, would you like help to learn more? So we want to know about that. And also any special considerations if this project has any foreign components, MOUs with other entities, or any subawards, any money going to anybody else. We need to know all of that sort of upfront. Okay, so important dates. I kind of talked about this already, but here it is sort of in print in front of you guys. So June 30th is when the LOI is due. We will announce results and invitations for the full proposal by August 1. October 1 will be the application for the full proposal. And then mid-December, on or about December 15th, we'll announce the awardees. March 31 is when the IRB has to be in place for funding that begins July 1 of next year, 2026. And then depending on the length of your project, it'll either be 2 years from that start date or 3 years from that start date. Okay, and so this last section is on how to apply for the funding. So very specific details on how to apply for this LOI. So all of our CTSC funding is a two-step process. So you have to go to Spark first, get your project ID, and then with that project ID, you go to InfoReady and you complete the full application. So in Spark, you can also access our consult services as well. So if you have any questions about anything having to do with the LOI, or is your research a good fit, any of that stuff, you can request a consultation at Spark. So here's a slide that kind of shows what Spark looks like. And we do this because we get a lot of questions about how to do this process. So you'll hear it from me, you have the slides, you'll have the webinar, it's in the RFA, but again, we can answer any other questions. So you'll go to Spark, and if you don't have an account, like any other entity, you sort of sign up for an account. That's at spark.case.edu. And then once you have an account, you can go to that green arrow is the funding opportunities, the drop-down menu, and you can choose clinical and translational science research program, which is this mechanism. You add it to your cart. And then you finalize that request. And then once that request is finalized, you'll have a project ID. That number is the one you then use for InfoReady. You can also do a research navigation request, which is that red arrow there. And that will route you to a consultation with either myself or Dr. Gherkin or Jerry Jewett-Tennant, who is our Assistant Director of Research Navigation. And that will also give you a project ID, and you're sort of in our system in that way. So Spark is our tracking system and our routing system. Okay, and then after you have your project ID from Spark, then you go to InfoReady. And this is the InfoReady homepage. So this is CASE's grant management system. Those outside of CASE, you can still get an account and log in. This is where you actually fill out and submit the LOI. And then if you're invited for the full proposal, the full proposal application. So you'll use your Spark ID and you'll enter it into InfoReady and finalize your LOI through InfoReady. So if there's any questions about InfoReady, you can contact me directly. My information's here, abc11@case.edu. So what's next? So you've listened to everything. You're wondering now what to do. So first, read and reread the RFA. I know we keep saying that, but it's true. Gather all the information required for the letter of intent and submit it by June 30th. And if you have any questions, you can, shoot them to us. And we're here for your success. So thank you so much for your time. So we're going to move into the question and answer portion now. I'm going to put up some FAQs here on the screen. So these are questions that we know that are commonly asked of us. And then we also have shared in the resources the answers to your specific questions when you registered for the webinar. Okay, so now we can open it up to any questions.
So Anna, I just want to say that the questions and answers, I think Laura posted them in the resources link on Zoom. If you click on the resources link, you will be able to go to documents and you can find the program RFA and also the questions and answers to the questions that were asked by the webinar attendees. please take a look at them. And if you still have other questions, we are happy to answer them right now, or you can email them to us if questions arise as you work on the letter of intent or the full proposal.
Are there any questions in the chat, Laura? I'm not sure if there are.
There's nothing in the chat just yet,
Okay.
but if anybody wants to raise their hand or type, or I can give you permissions to talk as well. Okay, one has come in. It says, have you had a collaboration with dental projects?
Let me think about this. I cannot think of an example right now, but as a researcher myself, as a translation researcher myself, I have a collaboration with the School of Dental Medicine, and we have been through the translational process with that project. So there is no rule against it. I mean, as long as the application is a translation research or translation science project, and if you engage with the Western Reserve University School of Dental Medicine, I'm not sure if you are from the School of Dental Medicine or if you want to collaborate with them, but either way, it's okay. It should be okay.
We have had annual pilots with the dental school in the past.
Okay, wonderful. Thanks, Shannon, for sharing that information.
Mhm.
So while people are thinking about questions, I would like to emphasize that the more you engage with the CTSC team and us in putting together your letter of intent, higher the success chance will be. So we have seen it in the past. The applicants who engaged with their questions early on, way before the due date, and ask for suggestions and advice and help from the CTSC team, their letters of intents are more likely to be invited for full application, and the full applications are more likely to be to review well. So we highly encourage consultations and engagement and asking your questions early to the CTSC team.
There's a question in the chat. If you receive
Yes.
more than one LOI on a related topic, particularly a related technology, would you connect and foster collaboration between the two groups?
Okay, that's a good question. During the time that I have been involved, I don't think we have done that, but again, there is nothing against that is possible. Shannon, have you done it before? If you are listening, maybe you can comment or let us know.
Can you hear me?
Yes.
To my knowledge, we haven't done that either, but what you just said might be a nice way to foster collaboration. So I think we could certainly help set up something if we do see two related applications come in or LOIs come in.
Yes. Especially since this is a much larger project, and we have like more limited number of accepted awards here. That's a good idea. Yeah, thanks.
There's another question. In addition to the Northern Ohio partners, are we permitted to include out-of-state partners too?
I think.
I would go ahead, Anna.
Oh, no, I was gonna say probably the same thing that you were gonna say, that if they are community collaborators, they could be, we need the two CTSC institutions, right? And then if it's a third partner, it could be a collaborator. I'm assuming it doesn't matter if they're.
It just has to make sense. Guys, I think for that question, you know, some perspective nationally, each CTSA has an element E built into their program. So this CTS research program RFA is being opened at other CTSAs as well. I would think it's probably more suitable to stay within our CTSA and national in our catchment area of Northern Ohio. But we do take all of Northern Ohio. So if Columbus has another CTSA, you know, we're from all the way from Akron and Neomed, all the way left to Toledo and right to Ashtabula. So we have the top third almost of Ohio. So I think staying within our reach is probably a better plan for this application. Now we do have other funding opportunities called UH3 mechanisms. Those require 3 or more CTSAs to collaborate, and that might be a better mechanism for what you're proposing.
We have another question. Is the initial IRB approval expected to be human subjects based? Meaning, can there be multiple IRBs? Example, first focused on simulation based and then following 2 years in clinical trial.
I'll try to take a stab at that one too.
Yeah.
So these projects will require prior approval from our funder. At the time of submission, we need to provide all IRBs for the project. I'm guessing the way that things have gone in the past is that they'll need all IRBs up front to be able to approve this project. Again, it's not a feasibility study. So you know, it's not the first year you show something and then years 2 and 3, you do something to, you know, beyond that, after the feasibility has been done. So my guess is they're going to want to see all the IRB stuff, you know, pertinent IRB up front. So we've never really done, I guess the short answer is we've never really done something where then you would move into a clinical trial phase later. We may have to get more guidance on that, but this may not be the best mechanism then for that project.
Angela asked, how many awards are granted each year?
So we'll award up to 3 awardees for this mechanism, and the funding cycle is either 2 or 3 years. So let's say awardee A has a 3-year project, awardee B can have a 2-year project.
How detailed does the budget need to be for the LOI? Are there any restrictions on the budget usage? And do we need to list all of the team members in the LOI?
Well, you have 1 page, so you need to be as detailed as you can be within 1 page. There is a whole list of allowable expenses in the RFA. I don't need to go into all of them right now. It's a whole table of them that's easily accessible for you in the RFA about allowable expenses. And I would say list all the PIs and if there's if there's multiple PIs, then list all of those, and the co-Is and any community partners or third partners.
Yes, about I would like to make a few comments. So in terms of budget usage and also the team composition, translation research and translational science projects are all about building unique, interesting teams that you may not be able to build in other basic research projects. For example, translation research and translation science projects by nature require multiple disciplines, multiple institutions, multiple expertise areas. We would like you to highlight those aspects. Like when you talk about your team, make sure that you meet all the eligibility criteria, first of all, and then on top of that, what unique aspects of your team can you highlight or indicate for the review panel? That would essentially make your project look like it's going to be successful because you have a unique and a strong and comprehensive team, for example. In terms of the budget, translation research, translation science projects, again, in my experience, require really a creative use of the limited funds that are available to push your project to the next stage. So any indication to that, again, there's not much space, but it should not be like a standard budget template. You know, there should be some interesting or some strategic elements maybe in the budget that would capture the attention of the reviewers. I hope this is helpful.
One last question in the chat here. I recently completed a successful Ready pilot related to newborn screening and rare diseases. Would the community collaborators and I be eligible to submit to this opportunity? The intent of the project is statewide implementation based on our findings from the Ready pilot.
Okay, so this is a good question. I have been actually thinking about this question since I read it. Let me try to answer, and Anna and Shannon, please add if I miss anything. Based on what I can see from your description, this project would be suitable and eligible for this research program. I'm assuming that the PI and your team meets all the eligibility criteria. You can double check those. In terms of the focus of the application, newborn screening, rare disease seems to be relevant, especially if you have a chronic disease focus. That's one of the NCAT priority areas. I can say that. Statewide implementation might fit well, but please also keep in mind Shannon's comments early on about the Northeast Ohio and the Northern Ohio aspect. So if you are planning an implementation study in the whole state, and if you are partnering with other institutions, that should be carefully considered. One suggestion might be just to focus on the CTSC of Northern Ohio institutions and then go from there. Maybe start in the Northeast Ohio or Northern Ohio and then go from there. That's it. That's one suggestion. Let me think about it a little bit more. Okay, one more thing. It might be important to highlight how the Ready pilot's findings might inform a new implementation strategy or whatever you are proposing. So essentially using the Ready pilot's findings or results as a preliminary result might be helpful. And you can request a consultation with the CTSC team because you have a more specific case here. We would look at your existing project and your proposed project plans carefully and make suggestions accordingly. That's all I have. Anything to add, Anna or Shannon?
No, not for me.
Okay,
No, not for me. Thank you so much.
thanks.
Okay, are there any more questions, Laura, that we know about?
Those are all of the questions.
All right. Okay,
Anna,
well,
can I say one more thing?
absolutely.
We actually received quite a bit of really good questions as part of registration, and those documents are shared. Please take a look at those questions. There are lots of clarifications we try to make and support that we try to provide. Yes, thanks for sharing the QR barcode. If you are not a member, please become a member. It will help you give access the CTSC resources. But I think, Anna, you will talk about that anyway. So that's all I have. Thank you very much.
No, so yeah, so like Uma was saying, you can collaborate with us in many different ways. Click this QR code to become a member. And we look forward to reading your letters of intent, and reach out to us with any other questions you might have in the future. Thanks for your time today and enjoy the rest of your day.